Let's be honest, if you're over 50 and you've noticed a few drops of urine leaking after you finish in the bathroom, or when you cough, laugh, or exercise, you are far from alone. This problem is incredibly common, yet most men never talk about it. So why does it happen? There are three main reasons. Weakened pelvic floor muscles. These are the small, hidden muscles that wrap around your bladder and urethra. Over time, they lose tone, especially if you've spent years sitting at a desk, gained some extra weight, or had prostate surgery. Changes in hormones and tissues. As testosterone slowly declines with age, the tissues around the bladder and urethra become less elastic. That means the valve that keeps urine in isn't as strong as it once was. Bladder overactivity. Sometimes the bladder itself becomes more sensitive and tries to empty even when it isn't full. This leads to urgency, frequent trips to the bathroom, and small leaks. The good news? You don't have to just accept it as part of aging. With the right exercises, stretches, and daily habits, you can regain control. And the three-step strategy in this video is designed to do exactly that, in a way that's natural, simple, and backed by science. Before you can fix bladder leaks, you need to understand the pelvic floor, a small but powerful group of muscles most men never think about. The pelvic floor is like a hammock of muscles stretched between your pubic bone in the front and your tailbone in the back. It sits at the very base of your pelvis and plays three vital roles. Bladder control. These muscles act like a valve, tightening to hold urine in and relaxing when it's time to go. Erection support. They help trap blood inside the penis during an erection, keeping it firm. Core stability. They work together with your abs and lower back to stabilize your entire body when you move, lift, or even just stand. When the pelvic floor weakens, whether from years of sitting, lack of exercise, or prostate issues, you lose control. That's when drips, urgency, and weaker erections start to appear. The good news? Just like your arms or legs, the pelvic floor muscles can be trained. Once you learn how to find them and work them correctly, you'll discover they respond quickly, often within weeks. This is why the three-step strategy starts with awareness, because you can't strengthen a muscle you don't even know how to activate. The very first step is awareness, learning to actually locate and feel your pelvic floor muscles. Many men try to do the exercises, but they end up squeezing their abs or buttocks instead, which doesn't solve the problem. How to find them? The easiest test is during urination. Try to stop the flow midstream. The muscles you use to do this are your pelvic floor. This is only a test. Don't practice this regularly. It can confuse your bladder. Another method, imagine you're trying to stop gas from escaping. That small lift you feel deep inside your pelvis, that's the pelvic floor contracting. What you should notice, it's not a big squeeze. It's a subtle tightening deep inside. Your thighs, buttocks, and stomach should stay relaxed. You may feel a slight lifting sensation in the perineum, the area between the scrotum and anus. Getting this awareness right is critical. Without it, any strengthening you try later won't reach the right muscles. With it, you now have control over the very system that keeps urine in and supports stronger erections. Think of it like finding the ignition key before starting the car. Once you know where the muscle is, you're ready to train it properly. Once you know where your pelvic floor muscles are, it's time to strengthen them. The most effective method is the Kegel exercise, but done the right way. How to do a basic Kegel. Sit or lie down in a comfortable position. Gently contract your pelvic floor muscles, like when you stop urine flow. Hold the contraction for 3 to 5 seconds. Relax fully for the same amount of time. Repeat 10 times. What's important? Don't hold your breath. Inhale as you relax. Exhale as you squeeze. Don't tighten your buttocks, abs, or thighs. Only the pelvic floor should be working. Quality is more important than quantity. Better to do fewer correct squeezes than many wrong ones. Progression. As you get stronger, increase the hold to 8-10 seconds. Aim for 3 sets of 10 reps per day, morning, afternoon, evening. Add quick squeezes. Tighten and release rapidly for 10 reps to train fast muscle response. Benefits: stronger control of the urinary valve, better ability to lock in blood during an erection, improve confidence, knowing you can trust your body again. Kegels are discreet. You can do them at your desk, in the car, or even watching TV. Done consistently, most men see improvement in leaks and erection quality within 4 to 6 weeks. Strength is only half the story. For your pelvic floor to work properly, it also needs the ability to relax. A muscle that's always tight cannot function well. It blocks blood flow, makes leaks worse, and can even reduce erection quality. That's why the third step of the strategy is relaxation and stretching. Why it matters? A relaxed pelvic floor allows the bladder to empty fully, reducing drips after urination. Stretching restores flexibility in the hips and lower back, areas closely linked to bladder control. Relaxation improves circulation, which directly supports stronger erections. Simple techniques: diaphragmatic breathing. Lie down, place a hand on your belly, and breathe slowly so your stomach rises and falls. This naturally relaxes the pelvic floor. Child's pose stretch: kneel, sit back on your heels, stretch arms forward, breathe deeply, feeling your pelvis release. Happy baby stretch: on your back, bring knees toward chest, hold feet or ankles, and gently open your hips. Pro tip: always pair strengthening, Kegels, with relaxing. Think of it like training any other muscle: lift weights, then stretch. The balance is what keeps your pelvic floor healthy and responsive. By combining awareness, strengthening, and relaxation, you build a pelvic floor that's not just stronger, but also more flexible and functional. That's the foundation of bladder control and firmer erections. Exercises are powerful, but your daily habits also play a big role in bladder control. Certain foods, drinks, and routines can either support your progress or quietly make leaks worse. What to limit? Caffeine, coffee, tea, energy drinks stimulates the bladder and makes leaks more likely. Alcohol relaxes bladder muscles too much, causing urgency and dribbling. Late evening fluids, drinking a lot right before bed can trigger nighttime leakage. What to add? Water throughout the day. Staying hydrated keeps urine less concentrated, which irritates the bladder less. Fiber-rich foods, vegetables, whole grains, prevent constipation, which puts pressure on the bladder. Pelvic-friendly nutrients, zinc, magnesium, and omega-3s help maintain healthy muscles and circulation. Daily routine tips: empty your bladder fully each time. Don't rush. Avoid just-in-case bathroom trips. They train the bladder to be overly sensitive. Maintain a healthy weight, since extra belly fat increases pressure on the bladder. These small adjustments often make a big difference. Combined with pelvic floor training, they help reduce leaks, improve control, and support stronger erections naturally. Most men don't realize it, but the way you stand and sit has a huge impact on bladder control and pelvic floor strength. Poor posture puts constant pressure on the pelvic floor, making leaks and weak erections more likely. Why posture matters. Slouching pushes the abdominal organs downward, adding stress to the bladder. A weak or unengaged core leaves the pelvic floor overworked and tired. Proper alignment allows the pelvic floor to contract and relax more effectively. Practical tips: when sitting, keep your back straight, shoulders relaxed, and both feet flat on the floor. Avoid crossing your legs for long periods. When standing, imagine a string pulling the top of your head upward. Engage your core lightly, not sucking in your belly, but keeping it firm. When walking, keep your chest open and stride naturally instead of shuffling or leaning forward. Core connection exercises: pelvic tilts, lie on your back, knees bent. Gently tilt your pelvis forward and back, feeling the pelvic floor engage. Bridge pose, on your back, lift your hips while keeping your core and pelvic floor engaged. Standing alignment check. Practice standing against a wall with heels, hips, shoulders, and head touching. By correcting posture and training the core, you reduce bladder pressure and give your pelvic floor the support it needs. The result? Fewer leaks, better control, and stronger sexual performance. Just like muscles, your bladder can be trained. Many men with leaks develop the habit of going to the bathroom just in case or rushing at the first urge. Over time, this makes the bladder more sensitive and less capable of holding urine. Why bladder training works: teaches the bladder to hold more without leaking, reduces urgency and frequent trips, supports the pelvic floor by preventing unnecessary strain. How to do it: track your bathroom trips. For a few days, write down how often you urinate. Most men go every 4 hours. Delay slightly. If you feel the urge, wait 5 to 10 extra minutes before going. Breathe deeply and do a few quick pelvic floor squeezes to hold it. Gradually increase. Over weeks, extend the time between bathroom visits by 15-30 minutes. The goal is to train your bladder to last longer without leaks. Stay consistent. A little progress each week builds up to big changes in control. Pro tips: don't overdo it. If you feel pain or severe urgency, go. Combine bladder training with Kegels for the strongest results. Be patient. It usually takes 4 to 6 weeks to see lasting improvement. Bladder training may feel challenging at first, but it's one of the most powerful tools for stopping leaks and regaining confidence. Pelvic floor training, lifestyle changes, and bladder retraining help most men. But sometimes leaks are a sign of something that needs professional attention. It's important to know when to call your doctor, when to get checked. Leaks happen suddenly and without warning. You feel burning, pain, or blood in your urine. You have frequent urges at night, waking up more than 2 to 3 times. Leaks continue even after several weeks of consistent exercises. You've had prostate surgery and the problem feels severe. Possible underlying issues: urinary tract infections, UTIs, can irritate the bladder and cause drips. Prostate enlargement or surgery side effects affect bladder control in many men over 50. Diabetes or neurological conditions sometimes influence bladder nerves. Why this matters? Getting a proper diagnosis ensures you're not missing a serious problem. In some cases, simple medical treatments, physical therapy, or medications can help alongside the 3-step strategy. Remember, bladder leaks are common, but they're not something you have to just live with. Doctors and physiotherapists deal with this every day, and the sooner you get help, the faster you'll see results. Now it's time to put everything together into a simple routine you can follow every day. It only takes a few minutes but can change your life if you stay consistent. Step 1. Awareness: finding the muscles. Spend 1 to 2 minutes each day practicing locating your pelvic floor. Do a few gentle test squeezes while keeping your abs and glutes relaxed. Step 2. Strengthening Kegels. 3 sets of 10 squeezes per day. Hold each squeeze for 5 seconds, relax for 5 seconds. Add 10 quick squeezes at the end of each set. Best times: morning, afternoon, and evening. Step 3. Relaxation and stretching. Pair every set of Kegels with 1 to 2 minutes of deep belly breathing. Add simple stretches, child's pose or happy baby, for 30-40 seconds. Supportive habits throughout the day: limit caffeine and alcohol. Stay hydrated, but avoid heavy drinking late at night. Practice bladder training by delaying urination a few minutes when you feel the urge. Maintain good posture while sitting and standing. Results: within 4 to 6 weeks. Less dribbling after urination, better bladder control, stronger erections. Within 2 to 3 months, improved confidence, fewer bathroom trips, and a stronger pelvic floor overall. This daily 3-step strategy is simple, safe, and proven. And the best part? You don't need special equipment or hours of training. Just a few minutes a day can put you back in control.